Good evening, Aztecs! It's a beautiful day to be an Aztec, isn't it? Thanks for tuning in to Channel 7 Evening News with your daily host, Milene Putras. Today we will be reporting on a serious matter that not only affects our environment, but also affects you individually. We all love to eat. However, are we eating the right things? Like most students, we're all stressed, busy, and tired, which makes it harder to focus on eating healthy. So we just mindlessly eat what we can. You may think it's the sugary junk food that is harming our bodies the most, but shockingly, there's another factor at play. Because we've been brainwashed to believe that meat is the best and only source of protein, we've been blaming the health consequences on everything else but meat. However, evidence has proven otherwise. As we consume large portions of meat, not only are we harming our bodies, we are also harming the environment. Raising animals for food produces more greenhouse gas emissions than all the cars, planes, and other transportations combined. According to the Food and Agriculture Organization of the United Nations, carbon dioxide emissions from raising farmed animals make up about 15% of global human-induced emissions. However, tonight our main focus will be on how meat increases the risk of diabetes, cardiovascular disease, and obesity. Excessive consumption of meat and meat products is often associated with overconsumption of energy and fat, resulting in excess weight, obesity, and an increased risk of chronic diseases such as cardiovascular disease and type 2 diabetes. For more on this topic, we'll go to our field reporter, Jordan Rogers. Jordan?
Thanks, Malene. I'm here on the beautiful SDSU campus with more information on our current health status as a nation. Unfortunately, there are a number of chronic diseases that are plaguing Americans today.
According to the CDC, there is an estimated 23.1 million people, or 7.2% of the United States population, with diagnosed diabetes. Furthermore, there are some 23.1 million people living with diabetes that have yet to be diagnosed. Another prominent chronic disease is actually the leading cause of death for both men and women, which is heart disease. The CDC estimates about 610,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths. These chronic diseases often accompany another rising health issue, which is obesity. Consuming more energy from foods and beverages than the body uses for healthy functioning, growth, and physical activity can lead to extra weight gain over time. So it is the high caloric intake that is really affecting our health. This graph outlines the rising trend of obesity through the last few decades. According to the CDC, the prevalence of obesity was 39.8% and affected about 93.3 million of U.S. adults in 2015 to 2016. To make matters worse, obesity increases the risk of both type 2 diabetes and heart disease. A study done by Philip E. Schreier and Joseph A. Hill, published by the American Heart Association, found that obesity-associated type 2 diabetes accounts for 90 to 95% of all diagnosed diabetes cases in adults. Furthermore, diabetes and insulin resistance are powerful predictors for cardiovascular morbidity and mortality. These health-related risks are one of the main focuses for the federal government's Healthy People 2020 campaign. One of their main areas of focus is nutrition and weight status, where they have a goal to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. They also have a focus on diabetes and heart disease, with a goal to reduce the disease burden of type 2 diabetes and improve the quality of life for all persons who have or are at risk for it. They also want to improve cardiovascular health and the quality of life through prevention, detection, and treatment of risk factors for heart attacks. This includes early identification and treatment of heart attacks, prevention of repeated cardiovascular events, and the reduction in deaths from cardiovascular disease. San Diego County is actually taking things a step further by introducing their Live Well San Diego initiative, where the focus is to have healthy, safe, and thriving communities here in San Diego County. They are based off of 10 main indicators, 2 of which are life expectancy and quality of life. Current mortality patterns place the average life expectancy today at 82.3 years, with California being slightly under that average at 81.2 years, yet still about the national average of 78.8 years of age. Of course, the other factor that needs to be taken into account is the quality of life, which the specific emphasis here is the percentage of population that are sufficiently healthy to live independently, which we know has a positive impact on physical, mental, emotional, and social well-being. The main focus here is obviously wanting the health and the well-being of our citizens to improve. One of the most effective ways to reduce these chronic diseases and obesity is through a proper diet. However, new data is suggesting that our heavy meat consumption is actually doing us a disservice when it comes to these chronic diseases. Recently, investigators from the Harvard School of Public Health found that a daily serving of red meat, no larger than a deck of cards, increased the risk of adult onset diabetes by 19%. Processed red meat proved much worse. A daily serving half that size, 1 hot dog, 2 slices of bacon, for example, was associated with a 51% increase in that risk. They are now suggesting that you get your protein from sources that are not processed and have less cholesterol, including beans, nuts, and to limit your intake of red meats like bacon, cold cuts, and other processed meats. Similarly, Neil Bernard, who is an adjunct associate professor of medicine at George Washington University School of Medicine in Washington, D.C., has done research in this field where he concludes that a meat-based diet is often associated with high prevalence of diabetes compared with dietary patterns emphasizing plant-derived foods. In his Adventist Health Study 2, after adjusting for differences in body weight, physical activity, and other factors, an omnivorous diet was associated with roughly double the risk of diabetes compared with a diet omitting animal products. When it comes to shifting to healthier eating patterns, updated legislation was passed by the Office of Disease Prevention and Health Promotion to provide a new set of dietary guidelines to go hand in hand with Healthy People 2020. Overall, they are pushing for an increased variety of protein choices and to make more nutrient-dense choices when it comes to filling in protein in your diet.
Now we would like to cut to a quick commercial break where we have a word from a nonprofit organization who is working to provide better alternative proteins here at SDSU.
When I was a Boy Scout in World War II, President Roosevelt put out the idea of Meatless Monday, 1 day a week not eating meat, and save the extra rations for the troops. We found out later that it was originated in World War I.
And it was a time of scarcity of food, and so Americans were called upon to preserve key staples for the war effort. So there was a Wheatless Wednesday and Meatless Tuesday, and that later was changed to Monday during World War II. 12 million people signed a pledge to go meatless on Monday, which was roughly 10 to 12% of the population at the time.
So it was successful then. Roosevelt used it. So I said, let's dust that off and give it another run.
In 2003, Meatless Monday was brought back by Sid Lerner, former advertising executive working with the Johns Hopkins Bloomberg School of Public Health. And it was brought back at that point to solve the opposite problem. Rather than not enough food, we really are facing the consequences of too much food.
Well, the USDA, the FDA, medical authorities put the number 15% more meat than we should be eating in our diet. And I said, well, there's 21 meals a week. If you took 15% out of that, that's 3 meals. And 3 meals, that's 1 day. Why don't we just have 1 day a week without meat? It was one of those appealing ideas that wasn't very hard to explain.
The other common element between Meatless Monday in World War I and today is just that sense of citizenship. We're all taking this action together that enables people to feel connected around a common cause. It's practiced in 40 countries around the world by schools and chefs and restaurants.
The Norwegian Army is doing it. Oprah Winfrey, Paul McCartney picked it up in 2009. Vegans and vegetarians and animal rights people and PETA and Humane Society.
There's really this sense of people banding together and just taking this small, simple step. And as a result of that, being able to really make big make changes together on our health and the health of the planet.
No matter what country or continent you're on, problems are global.
So our goal is to be everywhere, to go beyond 40 countries and be anywhere that people really are trying to focus on reducing a little bit of meat in their diet.
The best part of it, it's an idea that's lasted 100 years. I wish, it's a challenge for me to last this long.
And we are back to Channel 7 News. Over the commercial break, you learned about a non-profit organization that is followed by millions in over 40 countries. They provide information, news, recipes, and free promotional materials to help individuals, schools, restaurants, hospitals, food companies, and entire communities to start each week with a commitment to eating healthy, environmentally friendly, meat-free meals. They are also in association with the Johns Hopkins Bloomberg School of Public Health, so they are very involved with new research on the effects of meat on your health and the environment. Our field reporter, Jordan Rogers, is back on SDSU's campus with more on how students are bringing this movement to campus. Jordan?
Thanks, Malene. I'm here back on SDSU campus with a group of public health students from Dr. Yu's 301 class that is ready to bring the Meatless Monday campaign here to SDSU.
Meatless Mondays provides plenty of free downloadable resources as well as tools and tips to get you started, including implementation guides, posters, social media assets, logos, meatless e-cookbooks, and more. It is easy to sign up on their website to become an ambassador, where you get connected with the whole Meatless Monday community for support. The students intend to set up a booth at the weekly campus farmers market to help spread the word and resources to students here at SDSU. They can also then partner with local businesses that already participate in the farmers market, so they can provide more meatless options as part of their menus to help make meatless proteins more easily accessible to students here on campus. From there, they hope to move up to getting all of SDSU to participate in Meatless Mondays, where all of the campus participates in omitting meat from their diet at least one day a week.
There's a lot being done here at SDSU to help these students reach their health goals, and thanks to the Meatless Monday campaign, it looks like they're well on their way to achieving those goals before 2020. Back to Malene in the studio.
Thanks, Jordan. As you can see, there are many steps that you can take to improve your health. Protein is an important staple in a healthy diet. However, moderation is key. In order to achieve our Healthy People 2020 goals and reduce chronic diseases, we must incorporate other plant-based proteins into our diet and eat everything else in moderation. We hope you take what you've learned and go out and make a difference for not only the world, but for yourself personally. As always, thank you for tuning in, and we will see you tomorrow.